Okay, ladies and gentlemen, welcome once again to this latest edition of Usapang Panlungsod. And live na live ulit tayo dito sa Multipurpose Hall of City Hall. It's January 18, 2024. Okay, with Mayor Benjamin Magalong, I think he has an announcement, mamaya lang, we'll listen to it. We have here, of course, yung ating CESO Chief na si Dr. Donabel Tobera Panes, and of course, yung ating City Health Officer, Dr. Celia Flor Brillantes. Ngayon, yung ating Presscon po ngayon is live streamed over ang ating PIO Facebook page, City Government of Baguio, PIO Facebook page. At yung YouTube, okay? Nasa YouTube na rin tayo, okay? So I'm sure many of our friends in media and of course the public are using those media, those outlets, to see this Presscon right now, okay? So Mr. Mayor, you have the floor, sir.
Maraming salamat, Gabi, sa ating po mga kaibigan sa media, at sa ating po mga nanonood. Magandang hapon po sa inyo lahat. Naimbag na malam kada tayo amin na po. Yeah. This morning we had a meeting with the Department of Health officials and with the Epidemiological Bureau of the Department of Health, and we had a very extensive discussion on the epidemiologic investigation of the outbreak. And as a result of that, we can now confidently say that we are already out of the woods. The outbreak is over. So we're now shifting to an endemic level. We are now experiencing the usual occurrences of disease in our population in the city of Baguio. Meaning, ito na yung normal na mga diarrhea cases na nararamdaman natin. During that meeting this morning, we were also able to, one way or the other, let us say 80% determine the cause of the outbreak. And we have identified one way or the other, the cause and how it spread. Basically, the dynamics of how the outbreak spread, or how the diarrhea incidents spread that resulted into an outbreak. And this will be explained later on by our epidemiologists. Meantime, I would like to request Dr. Sel to give us more briefing on the outcome of that discussion this morning with the officials of the Department of Health.
Okay, Dr. Sel.
Yes, good afternoon. Okay, initially we were relying on our self-reporting system of diarrhea cases in the city of Baguio. And really it seems that it is similar to what our Epidemiology Bureau team also has discovered among the cases of diarrhea. However, we would like really to explain that really we had an outbreak of diarrhea or acute gastroenteritis in the city of Baguio from December 2020 to January 13. But the cases that were under the case control study were the cases from December 26 to January 13. Resulting from a waterborne source, which is water sources have been contaminated. We had human sample tested positive for norovirus and other viral etiologies. However, bacterial culture is still ongoing, and it cannot still be ruled out for bacterial pathogens. So since we have a past 2 incubation periods of our cases significantly going down, and that there are no cluster cases from the peak of our outbreak from January 7 to 8, and that we have already also identified water sources, then really the outbreak is over.
Dadagdagan ko lang, Gabi, we conducted a very extensive test of various sources of our water sources of our water in the city of Baguio, both private and from the Baguio Water District. And we have subjected these specimens to both bacteriological tests and virology. So I can confidently say na lahat ng klaseng test na ginawa natin dun sa water na supplied by the water district, it is totally and I would say completely and absolutely safe. So in short, you can now drink directly from the faucet. Ganon ka-potable yung water natin. No? Ganon kalinis yung water ng ating. So there's no contamination insofar as Baguio District water supply. As long as it doesn't go or it pass through an intermediate storage. Ibig sabihin, from the filtration system, diretso sa distribution line hanggang sa faucet, pwede niyong inumin ho yan. Malinis ho yan, basta Baguio Water District. Kaso ho, pag merong tangking dinadaanan, yan ho, kailangan ho talaga ng filtration yan. No? So yun po anong kalinis yung ating tubig ho dito sa siyudad ng Baguio. So the rest will be further information will be provided by our epidemiologist, si Dr. Donna.
Doc Donna?
To share the result of the investigation of the Epidemiology Bureau. So as isususugan ko lang sinabi ni Mayor how comprehensive this investigation was because we have conducted methodologies such as records review of all the cases that has been seen in the hospitals, active case finding even in the community, yung mga hindi nagpa-check up, hinanap sila. And then tinignan din kung may mga neighbors who had same signs and symptoms who did not seek consult. Interviews were conducted with in the water district, some water delivery services, and even some establishment. The managers, they were also interviewed. Environmental survey was also conducted. Even the weather indicators were also done to correlate the results. And the one that is unique for this case is we did laboratory confirmation sent to the Research Institute for Tropical Medicine. And just to look at risk factors, a case control study was done. Ibig sabihin po, naghanap ng kaso, and then naghanap din po tayo ng hindi kaso who lives in the same area, and then identify some risk factors. What makes this case have symptoms, yung iba wala. And these were we also did a previous chart reviews. Tinignan po from 2019 up to the present, we look at the incidence of cases of acute watery diarrhea in the city, including cholera cases, bloody diarrhea, and typhoid fever for the past 5 years. And the source of data will be coming from the health facilities in the city. Just to look at if there's really an increase in trend, comparing this particular point in time compared to the same period last 5 years. So that's how we look at outbreaks po. We don't declare it like as such unless we review previous cases and we use 5-year average to compare. And the findings was based on this December 26 up to January 15, there were 383 cases who sought consult with an average age of 27 years old, but as young as 3 months up to 90 years old were done. So it started to peak last December 26 as a slow increase from December 26 up to December 31, and there was a steep increase from January 1 up to January 8. And from January 8 po until now, we already see a downward trend. So comparing the past recent 7 days, comparing it to the past 7 days, 2 weeks ago, we saw an 80% decrease of cases from 1,620 to 300 cases. the past 7 days. So that was an 80% decrease of all our cases. But looking at the geographic distribution of cases, they are really spread across the city. Hindi siya located lang po sa isang barangay or isang district. So that's how widespread the distribution is based on the addresses of the cases. Okay po. And it seems that all age groups are affected. Walang pinili yung all ages are affected. But the one that they saw with the highest admissions are the pediatric age group. So which is, we understand. Kasi pag bata nga naman nagtae, ang nanay dadalhin talaga yan sa hospital. So we see that trend also. So indeed, based on that definition that we have used, acute watery diarrhea is the most common symptoms, and then vomiting and abdominal pain. A few said that they have fever, etc. This was the conclusion of the probable, if I may qualify that word, I will use the word by the Epidemiology Bureau, the probable chain of transmission. Ibig sabihin po, ito yung tinitignan na highly probable that has caused the outbreak. So there were positive water samples from deep wells, water samples who were positive for total coliform and E. coli, in which these bulk water deliveries fetch, doon sila kumukuha. So this bulk water delivery trucks also delivers to the households and establishments. So in that line, the probable chain of transmission, as mentioned po by Dr. Sel, the water, contaminated water, that in certain deep wells, and then the bulk water delivery service trucks distributing to the households, is one of the probable chain of transmission that has been documented by the Epidemiology Bureau. We are still waiting for some of the results now. As per Research Institute for Tropical Medicine, it will be out tomorrow. A few left among the water samples that was sent. So the conclusion was there was a diarrheal outbreak in the city of Baguio from December 26 to January 13, resulting from contaminated water sources. Human samples tested positive for norovirus and other viral etiologies. However, culture is still ongoing and bacterial pathogens cannot be ruled out. Since 50% of those isolates are positive for norovirus, the possibility of human-to-human transmission or person-to-person contact explains the spread of the infection. It's really the fast spread could probably also coming from an infected person now affecting members of the family due to pwede na pong contact ang ating so it's not, maybe it could start in water, but when you don't wash your hands and then you start touching objects, you prepare food, nagtatai ka, ikaw tagaluto sa bahay, then the possibility of secondary transmission is possible. So looking at it, there were some people who did not go out but started to have symptoms already. So these were some of the identified probable symptoms. So a case control study was done. Ibig sabihin po, tinignan yung mga nagkaroon ng kaso at hindi nagkaroon ng kaso. And the odds of having diarrhea is higher. Looking for that number, the odds of having diarrhea is higher among those whose water delivery, yung nagpapadeliver ng water. So that was the risk that has been found out by the Epidemiology Bureau. So I think that's all, sir. Thank you.
Okay, so at least it's official, ladies and gentlemen. The diarrheal outbreak in the city of Baguio is finally over. Okay, so we now go to our friends in the media. As usual, Vincent, our diarrhea whisperer from Philippine Daily Inquirer kindly lead the the questions. Okay. Mag-smile kayo. Tama nakasmile si Vincent kasi wala nang diarrhea. Over na, okay? Ayan, so Vincent and then maybe si Ma'am Mia of Rappler and syempre yung mga iba dito, okay? Come on, Vincent. Good afternoon to you.
Sorry. Good afternoon po. Good news. Pwede sabihin magtatrabaho agad ako. One sticking point, I understand where it's going now. Meron lang akong gaps information that needs clarity. During the City Council session, the mall was there defending themselves. And they did admit that there was a faucet in one of the establishments in the mall that tested positive. Significant ba yung faucet na yun with regards to the spread ng contaminant in that area anyway? It's very clear kasi na malinis yung kanilang cistern, malinis yung bawadi lines nila. So even at that stage, ang theory na pinopropose nila yung water delivery. But that faucet kasi curious kami kung ano yung significance niya. For that period, yung period na yun ng spread. Kasi very very small yung period na kumalat. I'm actually asking the epidemiologist.
Sige, Doc Donna.
Actually, the findings during the key informant interview with that establishment is that during the holiday season, they saw that there was an increase in demand of water. So they started to fetch waters from not the usual set of bulk water delivery trucks that they usually fetch water from. So may mga nadagdag po because of the high demand of water during that time. But to zoom into one faucet, there has to be a collection of water and subject them to bacteriological and virological tests. But pointing to one will not be enough to explain the whole the vastness of the cases in the city.
So it's basically just one detail na medyo hindi po ma-explain yung impact. Are you saying, or hindi talaga siya significant sa spread? I mean, that one faucet. I'm just clarifying.
Yes po. It can. There's a possibility that it can cause that, but not enough to explain the whole number of cases that we saw also.
Okay. Actually, yun lang po ang question kayo. As soon as the outbreak, ngayon na-declare na over yung outbreak, ano magiging process going forward? We're still waiting for the results. I'm sure kasi hindi bintangan, like you said, hindi bintangan ang punta nito eh. It's clean up and rehabilitation.
Yes.
How can we require all depots to start cleaning up? Ganun pa ang mangyayari?
Actually, na-require na natin. Moving forward. Now, we're done with the epidemiologic investigation.
Yeah.
So we're now shifting to the investigation on the liability and culpability of the water delivery services. Meaning, inspekin na namin yung kanilang mga sources, the same time, yung kanilang mga trucks, mga equipment, pati na rin yung kanilang processes dyan, pati na rin yung kanilang mga records. Inspekin na namin lahat yan, imbestigahan na namin sila. Although they were already given advice to undertake all sanitation procedures para siguradong malinis yung kanilang mga tubig. Pero babalikan uli namin sila. Okay. Dahil this time, it will be a more intensive na inspection ang gagawin natin.
Yung initial po na discussions, ito yung with the 173 na may license to draw water, not the whole 1,003 na identified na deep wells.
Halos Yes, mag-umpisa kami doon. Pero unti-unti naming inspect and condemn imbestigahan doon yung ibang mga deep wells natin. Kasi nga, it appears na baka, malamang, because of the high demand of water, kuminsan sa isang deep well, maraming nakapila, baka merong enterprising na water delivery or truck na pumunta sa isang illegitimate na deep well, doon kumuha. Not knowing na most of the time, itong mga illegal na deep wells na ito, hindi naman ito compliant sa sanitation standards.
Only nag-report.
Yes, oo. Kumukuha sila dyan. No? Kung yung mga out of the 12 na in-inspect nga natin na sources of water nitong delivery services, out of the 12, 7 ang lumabas na nag-positive eh.
The
Ibig
deep
sabihin, may
wells mismo,
contamination.
Yeah, we're talking about the deep wells itself. No?
Yes, oo. Yung 7. 7 ang nag-positive ng E. coli eh. Although 12 nag-positive sa coliform, kung pa lang yun, after the coliform, you have to shift to determining anong subgroup na bacteria. So they were able to determine yung E. coli. Ano? So 7 nun.
How are they supposed to clean? Actually,
Chlorination. Meron procedure yan eh. How to clean. Yung mga legitimate, alam nila yan eh. Chlorination. May mga process silang ginagawa dyan eh. May methodology to really ensure na talagang yung water mo from that well pass the sanitation standards or health standards.
May I ask, kasi some of these are also for household use, I'm assuming.
Yes.
So yung pamilya po ba ng mga yun na may-ari, nagkasakit din?
Pag yung may E. coli yun, malamang, nagkasakit din sila kasi meron kaming mga nalaman na mga personnel na mga water delivery services na nagkasakit din eh.
So it
Yes.
boils down to the same.
Yes. Including their family.
Yeah.
Kasi nga, yun na nga yung tinatawag natin na propagated na transmission or propagated na outbreak. No? Yung nagkaroon ng diarrhea, isang membro ng pamilya, siyempre uwi sa bahay, magpe-prepare ng pagkain, o kaya magpe-prepare ng tubig, hindi properly sanitize, ma-effect niya yung ibang membro ng mga pamilya niya. Patapos yung ibang membro ng pamilya niya, pumapasok doon sa opisina. Iba rin, nagtatrabaho din sa mga food establishment.
Kaya ko po naitanong baka part yun nung transmission?
Yun yung secondary transmission. Pero yung primary, waterborne siya.
Okay.
Nag-umpisa doon sa water delivery services, nag-distribute. Kaya iba-ibang lugar eh. Napansin mo, iba-ibang lugar. Ganun kabilis eh. Kasi kung food, usually, ang pagka-explain sa amin, pag food,
Cluster lang dapat.
cluster lang dapat. Patapos, dapat mabilis yung increase, mabilis din yung pagbaba. Kung titingnan mo yung epidemiological curve, very wide.
Yeah,
Very wide. Ibig sabihin, very wide siya.
that confused us for a while.
No, very wide siya kasi nga widespread siya. Kasi nga waterborne. Eh. That's explain the shape of the graph.
Yeah.
Although very dramatic rin yung pag-decrease because of the effective containment and preventive measures na ginawa natin.
And the ailment itself talaga, it more or less resolves itself, no? The diarrhea more or less resolves itself.
Yes, kasi self-limiting naman yung virus. Most likely nga, sabi nga ng ating mga epidemiologists, most likely, sabi ng mga health officials natin, most likely, the cause of the acute gastroenteritis or diarrhea is the norovirus.
Okay.
Norovirus. Most likely. Kasi meron pa ongoing na mga ginagawang test pa ng mga specimen.
Again, just to be clear, kasi baka ma-misinterpret namin eh. Yung 12 na nag-positive, are we treating them as the source already? Hindi pa automatic yan.
Most likely, they are the source.
So-
Yung
so-
7, especially yung 7 na may E. coli.
So suspected sources.
Yes. Okay.
Thank you.
Okay, thank you, Vincent. Next, we have Ma'am Mia Faulkner of Rappler. Ma'am, good afternoon to you.
Hi, good afternoon. Dr. Radona, I'm just confused kasi, di ba, nag-positive tayo ng viral, noro, and sapo. Pero yung sa tests ng water, E. coli, which is bacterial. Based dun sa test, so, viral infections, they resolve on their own. But with E. coli infections, this will require medication. Correct? So among the cases, which were more?
Pending the bacterial results po, which will come out tomorrow, 50% of those cases were isolated to have norovirus. So, E. coli and norovirus, lahat po yan lalabas sa poop natin.
Yeah.
So, it is likely, as explained to us by the investigators, is this likely that it is contaminated with E. coli? The likelihood of it contaminated with norovirus is also high, except that our laboratory laboratory here in Baguio cannot isolate
and SAPO.
norovirus po.
Okay, so pending the results from RITM, ma'am.
Yes.
Ah.
Okay. We asked the same question. No? Kasi nga na-confuse din kami. No? Ano ba pagkaiba ng E. coli at yung virus? Ano? Okay.
Bacteria
Una,
yun
yung
kasi.
E. coli, kailangan mo ng
Antibiotics.
antibiotics. No? Yung pa naman ng virus is self-limiting. That is actually my question also kanina. Same question. Ang explanation nila, yung coliform pala, once you determine yung coliform, ibig sabihin, kailangan i-test mo rin
Kung anong
anong
strain.
bacteria, anong subgroup. So, merong mga cases na may coliform pero negative naman sa E. coli. Kasi E. coli is human. Di ba? Human bacteria. Now, ang E. coli pala, yung pala yung indicator lang siya. Indicator lang siya na yung tubig o yung pagkain, merong fecal contamination. So, isasubject mo ulit sa virology. Para malaman mo kung anong type ng virus na nandoon. Okay?
Thank you. Yeah. Last. Considering na water delivery yung most likely source of spread, what are the long-term solutions we're looking at? Are there plans to improve the overall water supply system in Baguio City to reduce the dependence on water delivery services?
Okay, very good. Very good. Thank you. That's the way forward namin ngayon. No? Now, that's the reason why we're shifting to the investigation to determine yung culpability and liability naman itong mga water delivery services who we believe, who suspected na saan sa kanila galing. No? So, investigation namin. At the same time, we will be coming up with stringent measures, methodologies, parameters, mas stricto ngayon para sigurado tayo na highly compliant sila sa health standards, sanitation standards. Like for example, dapat yung truck mo talagang malinis na malinis. Ano, hindi pwedeng may nakikita kaming mga moss o kaya may mga fungi na nakikita mo dyan, may indications dyan. Another is, sisiguraduhin namin na yung mga host mo, lahat malinis dapat. No? Instead na talagang ang mag-i-inspect ng kukuha ng sample, hindi na ikaw yung magsasubmit ng test results mo. Kami na mismo ang kukuha ng specimen para kami na rin ang mag-lab. Hindi yung ikaw. Kasi may nalaman kami na nag-submit siya ng iba pero yung pinagkukuhanan niya iba naman. Di ba? Nabisto rin namin yon. Second is, nalaman din namin na nalaman din namin na 107, oh yes, parang nandadayas sa drug test. Ganun, di ba? Nagdadayas sa drug test. Nagbibigay ng ibang specimen, di ba? Another is, marami pa palang unregistered na delivery trucks. Yeah. Kaya hirap na hirap kaming maghanap ng mag-track down. No? Another is, lumalabas na maraming hindi nagme-maintain ng log o ledgers nila, walang records. Records ng transaction, kailangan din yun, di ba? So, these are the things that we need to do. Para madali na sana na matrack down namin sila. So, a lot of things have to be done. So, itong nangyari sa atin, there are a lot of learnings. In the same manner na may mga silver linings dito. Daming silver linings. One is, nakita natin na kailangan pala natin baguhin yung ating sanitation code. And probably come up with a separate safe water ordinance. Another is, kailangan pa palang natin mag-implement talaga ng more stringent na mga policies. To ensure na talagang compliant sila sa standards. Another is, nalaman din namin na may separate effort may separate effort ang DOH because they issue a different permit. Kami rin we're issuing a separate permit. Pag isa na lang para align siya, may alignment kaagad. Pero pag-iisipan namin, kailangan integrated din yung aming mga procedures. So these are the things that we're looking into para maayos yan. So after the investigation, yung culpability, then we'll start working on the ordinance.
Thank you, Mayor.
Okay, thank you.
A little thing I remembered kasi you mentioned about cleaning the trucks, the moss, and the growth. This should hold true for households also, their tanks. Kasi it was mentioned yesterday in Bawadi's, ideally daw sana 6 months. Kahit mag-flush lang ng tank. Para to din yung growth. Kasi pwede din mag-stick doon at microorganisms. Yun lang po. Thank you.
Okay, Ma'am Mia, thank you so much. Before we go to our online questions, care of si Ms. Jessa here, let's go muna from the Chronicle. Okay, Ate Malu, give.
Good afternoon. I think we can say the outbreak opened Pandora's box in the private sector of water deliveries. I'm wondering, when we say raw water, do we mean yung sa deep well?
When you say raw water, ito yung hindi pa filtered.
Okay.
Like for example, yung raw water yung nandun sa Santo Tomas, catch basin natin. That's raw water.
Okay.
Pati yung deep well,
Okay.
that's raw water. It has to go through a filtration process.
I'm just wondering, if from the deep well, meron na test na po and it tested positive, 7 out of 12. Actually, 12 tested for coliform positive, 7 had E. coli. And this is direct from the deep well pa po, yung na-test. Hindi po kaya possible may seepage between the sewage and because it's still underground? I'm just wondering.
Maraming possibilities.
So that's one.
One is probably surface water na contaminated was able to contaminate yung deep well, yung water sa deep well.
Okay.
But not necessarily naman hanggang sa groundwater.
Are we ruling that out?
Hindi naman kasi may pressure yung potassium eh. Na-explain naman sa amin ng mga kanyon hydrologists, hindi naman ganun.
Of the 12, or maybe the 7, or maybe all the 12 na deep well po, ilan po ang sila din yung, kasi I would assume the final filtration or sanitation would be in the water station, where we directly get those who deliver. Sa mga deep well owners po, ilan po sa kanila din yung
Water delivery, bulk water.
Water filtering station and delivery.
Okay. Kasi dalawa yun eh. Yung water delivery kasi natin, explain namin, meron kasi yung bulk water delivery. Ito yung malalaki na pupunta sa tangke mo. Meron naman yung delivery natin na potable water na yun. So, Sel, paki-explain mo nga, Sel, yung resulta ng 12.
Yung water test results for the total coliforms po, 12 galing po sa bulk water delivery trucks.
Okay.
Okay,
Hindi
trucks.
pa yung potable na dinideliver in
Hindi.
those plastic. Okay.
Hindi
Yung
po,
sa
hindi.
bulk siya.
Opo, it's a bulk from the trucks po,
Okay.
that carries the raw water to the consumer
That they
po.
deliver to the tanks.
Yes po, to
Yeah.
the tanks and
Or
to the
drums,
consumers.
yeah.
Yes po. Yes. And yung end user, though marami din po, so 12 din from the different establishments and other sources like the deep well, and we have nothing from our water refilling station was found out to be positive for coliform.
So from the water stations, the ones yung may machine.
Refilling, yeah, yung purifying machine.
No, but none tested
None.
positive.
Yes po.
Okay,
for
that's
none,
good
yes,
news.
out of the 4. Yes.
So doon lang sa bulk water ang may mga positive. Okay, thank you.
Okay, thank you, Ate Malu. Jessa, maybe you can share the questions, online questions.
Good afternoon po. I'll just read the text in question from our online viewers. Related po sa tanong ni Ma'am Malu, constant question din po, Mayor, why are we not publishing the names of the establishments that has tested positive of contamination?
Well, alam mo, kailangan rin natin i-kuan din. Ang importante nun is sinarahan natin. Sinara natin, no? And it's just a matter of please trust us. We're doing everything. And besides, we've given them a cease and desist order to operate until such time na malinis sila. Malinis yung water nila after we have comprehensively tested their water.
Thank
So
you,
we
sir.
decided na to just keep silent about it.
Thank you, sir.
Kasi meron kaming, anong nangyari kasi is, merong cases na nagkaroon ng contamination ng specimen na lumabas kagad na nag-positive for coliform, negative sa E. coli. So what we did was to retest again. Niretest namin sa ibang laboratory. It turned out na negative. So maingat kami. Hindi basta-basta na nag-positive kagad. Ilalabas kagad namin yung pangalan. But this time, talagang positive itong ginawa namin na test dito sa 12. And definite na yun, yung out of the 12, 7 talaga nag-positive din sa E. coli. Siguro dahil sa kwan din, nawala na rin sa isip namin na mag-publish ng mga pangalan because we're just so preoccupied kami dito sa investigation na to.
Thank you, sir. Ay, wait lang po. Ito po, from Ms. Liza Agoot. Paano nagkaroon ng contamination ang source? Malapit ba sa septic? And can you give us details po?
Yan, Doc Dono siguro.
In time, hindi kasi natin directly na masabi na may contamination. But there was a consideration of a possible contamination from water runoffs, etc. That was how it was said to us, from water runoffs, and it can contaminate the water source. So that's one consideration. Aside from that, yung cleanliness nung tanks were also considered. And with the fast spread, we're looking at more now of the person-to-person contact na nag-cause ng steep increase ng cases.
Thank you po, Doc. Related question po siya on public health sa ating doctors. Is there a regular monitoring among the barangay health workers and the sanitation division on possible open defecation or leaking sewers? That I think baka ito daw po yung na cause ng contamination.
Yeah, very possible din. Very possible lahat yan. Kaya nga, babalikan namin yung mga, mga deep wells na yan at alamin namin. We're going to inspect pati yung surroundings, para nagkaroon ng possibility na surface water na contaminate niya yung deep wells. These are the things that we're going to investigate. Ito yung moving forward.
Okay. We have here also online, may I just express my thoughts on BWD, that's the Baguio Water District. Even if their water sources were clean or cleared, but the pipes distributing waters to the barangays are old and rusty, it can contaminate the water to our households. We experienced this last October, We have canal water in our tanks, and we investigated on our own, and it was from BWD. Water pipes in our street were old pipe buried under canals, so it was old, rusty, and corroded. A lot of dirty water was seeping through, okay? The employee said that these old pipes are still used around the city. I hope these old pipes can also be addressed because it can also contribute to the contamination. Thank you for your time. Any comment on that, Mr. Mayor?
Maraming salamat sa ganyang information. These are the information that we need, and rest assured that we're going to immediately relay this. After this, I'm going to talk to the GM to raise this concern.
Okay. Do we still have online questions, Jessa? Wala na. How about our friends in media? Meron pa bang questions dito? Para kung wala na, maybe we can ask the mayor again to mention the good news once again and say that it's over and safe yung tubig natin, Mr. Mayor.
Parting message. Ano? Una-una, gusto lang kong ipaalam sa lahat na tapos na po tayo sa outbreak. Ano? Nasa endemic level na po tayo. Ito na po yung mga normal na mga diarrhea. Gusto ko rin kong banggitin na nung nakausap ko si Yusek Rosette kahapon, alam mo, sabi niya sa akin, alam mo, Mayor, every year naman meron tayong outbreak ng diarrhea sa iba't ibang mga lugar. Nagkakataon lang na hindi gaano nabibigyan ng pansin. At kuminsan, itatago na lang. In your case, nabigyan nyo ng pansin At tapos gumawa pa kayo ng sistema ng self-reporting. Kaya nakita natin kung ano yung sitwasyon. And we really appreciate, no less than Secretary Ted Herbosa conveyed his commendation to the City of Baguio for the quick response na ginawa natin, for the efficient response na ginawa natin. Dahil na-heighten pa natin itong tungkol dito sa iba't ibang mga viruses, norovirus. Kasi dati-rati naman, ito naman is something na very common. In fact, at present, underway ngayon yung outbreak, norovirus outbreak sa US at sa Canada. That's why they call it the winter vomiting bug. No? And it is also common sa ibang lugar din to. Kaya nagkataon nga rito na umaksyon kaagad tayo, nakita natin, nag-collect kaagad tayo ng data, pinakita natin, we were very transparent, pinakita. So na-highlight na meron palang ganitong klaseng virus. So again, I would like to express my thanks to the entire team of HSO natin, led by Dr. Sel and our epidemiologist. Maraming salamat sa inyo. Thank you din sa ating Department of Health, Cordillera, led by formerly by RD Rio. Now, magpantay. And now, we just learned na si RD Meli Pangilinan is back. So, siya na ngayon ang Regional Director. So, thank you very much to DOH-CAR for all your support. Ang bilis din ng suporta nila when humingi tayo ng tulong sa kanila in terms of medicine, pati additional field personnel. And I would like also to thank si Yusek, si Secretary Ted Herbosa, and of course, Yusek Eric Tayag. Kasi isang tawagan lang, nagpagdala kaagad ng mga investigador, especially itong members ng ating tinatawag nilang EB or Epidemiological Bureau. So we would like to thank everyone, of course, our friends from the media for coming up with, for all your objective na mga press releases. Maraming salamat. And once again, we were able to prove that if the public is well-informed, then a well-informed public results to a better, we are better in dealing and coping up with this kind of situations. So there's no substitute to transparency. There's no substitute to good governance. Maraming salamat po sa inyo lahat.
Okay, thank you, Mayor Benji Magalong, Doc Sel, and Doc Donna. And to everyone here, God bless all of you. Let's stay safe, everyone. So, Happy New Year once again. God bless. God bless. Thank you po.
Kita mo?
Pero sir, mag-heighten pa lang din kami ng surveillance.
Sige.
So, may
tuloy-tuloy lang.
May mga packet na